More than 10,000 jobs are being cut at the Department of Health and Human Services. This comes as Secretary Robert F. Kennedy Jr. plans to restructure that agency and reevaluate protocols when it comes to vaccines, food, and water.
Columbus Bureau reporter Morgan Trout tells us some Ohio lawmakers are trying to follow in RFK Jr.'s footsteps.
Ohio is known for our water and the benefits that dentist Dr. Matthew Messina sees from it.
We've had that kind of a profound increase in public health that comes from modern dentistry, and fluoride's a part of that.
Naturally occurring in water, fluoride is a mineral that research has shown for years strengthens teeth and prevents cavities and tooth decay. As the 4-decade-long serving dentist explains, most public water systems add fluoride.
Hailed in the top public health measures in the last century.
But in recent years, there's been a campaign to push back on fluoride in water. Although U.S. Department of Health Secretary Robert F. Kennedy Jr. is not a doctor, he has argued that the mineral is toxic. And the effort has trickled down to Ohio. State Rep. Levi Dean has proposed House Bill 182, which would ban public water systems from adding fluoride.
It just says that individuals can then choose whether they want to ingest it or not. It's not forced on them.
Current law requires water systems to fluoridate water if the natural content is less than 0.8 milligrams per liter. Dean wants to prohibit this requirement, citing a recent research study sharing that fluoride may be linked to lower IQ in children. But Messina explains that this research article is being taken out of context.
It brings up a study of parts of the world where naturally occurring fluoride levels are much higher than in most of the United States, and they're higher than the target levels that we have set.
There's disagreement on the concentration of where that starts and how, but that's why I think it should be up to the individual to choose what levels they engage with fluoride at.
Looking into the research paper, the authors acknowledge that a majority of the studies they looked at were considered highly biased. Still, the lawmaker argues that if people really want fluoride, they can buy toothpaste, tablets, or drops. What kind of concerns do you have with Ohio considering to remove fluoride from all public water?
If Ohio did that, we would be stepping back in time. We have a known beneficial preventative part of our toolkit. And for us to continue to go forward without that, we're really leaving one of our best weapons behind.
The Ohio House Speaker said he's interested in the bill and that we should consider stopping efforts to add more fluoride to our water. At the Ohio State House, I'm Morgan Trout reporting.